Hello, everyone, and welcome to AMHCA Live. For today's Facebook Live segment, we're joined by AMHCA's Executive Director and CEO, Joel Miller, to discuss the impact of COVID-19 relief packages on behavioral health. If you have any questions during today's presentation, please feel free to ask these in the comment section below. Without further ado, I'll now turn it over to Joel.
Thanks, Rebecca, and thanks again for all the great work in setting up these Facebook Live events on timely legislative regulatory issues that we're trying to keep tabs on for the membership. Welcome everybody. Good afternoon or good morning out there, folks out west. There's been a lot of coverage in the media about President Biden's new economic relief legislative package over the last several weeks. I'm sure somewhere along the line you've seen some coverage on TV or social media as well as in your local newspapers. And we thought it'd be important, since the legislation is now officially passed both the Senate and the House and will be signed by President Biden. It's expected tomorrow, and I think he's going to be doing a national address tonight, but he is expected to sign the legislation tomorrow, officially implementing what's called the American Rescue Plan. Next. So what is this American Rescue Plan that has been passed by both the Senate and the House? The House had passed one version a couple of weeks ago. The Senate did amend some provisions, which I'll talk about. The House just yesterday approved the amended version, and it's going to President Biden's desk for signature, as I mentioned, tomorrow. This is nearly a $2 trillion coronavirus or COVID-19 relief, financial relief or economic relief package, which is designed to facilitate recovery from the devastating, economic and health effects of the COVID-19 pandemic over the last year. And it really is a variety and mixes in several provisions that have been discussed on and off over the last year, some that are embodied in other economic stimulus packages that were passed, last year with some add-ons, but some new things to address the economic effects of the pandemic, as well as strategies to fight COVID-19. And it is an incredibly huge package, which allocates, funds for distribution and manufacturing, distribution of vaccines, monies for schools, small businesses, several kind of anti-poverty programs, such as the expanded child tax credit, which I'll talk about in a few moments. So let's go through each of the major provisions of the American Rescue Plan. And again, this overall is a $1.9 trillion relief package. Now we use the word, relief rather than stimulus because the stimulus packages were more aimed, I think, in 2020 towards organizations, businesses, and this is very dedicated to addressing the needs of individual Americans. And the bill that's passed now out of the Senate and the House is going to provide $1,400 per person in terms of stimulus payments, and individuals earning less than $75,000 a year and married couples earning less than $150,000 will receive $1,400 per person in their family, including children. And that money, those monies will get to about 90% of households based on the estimates from various experts. So if you're a family of four and you're earning less than $150,000 a year, you can expect something like a $5,600 check, $1,400 times 4 people. So the expectation is those checks will be going out by the end of March. The checks are going to phase out a little bit faster than previous checks as part of the COVID-19 economic packages that passed in 2020, but Obviously, this is going to be very important for a lot of people who are hurting financially. Another major provision component of the American Rescue Plan is unemployment assistance. The Senate version, which passed out of the House yesterday, will provide an extra or additional $300 federal boost to weekly jobless payments and extending two key pandemic unemployment benefit programs all the way through early September. And this was an arrangement that was really hammered out just really a few days ago over the weekend. And the agreement will also make the first $10,200 worth of benefit payments tax-free for households with annual incomes less than $150,000. And so this was a significant change from the House bill that had a $400 weekly enhancement to payments, unemployment assistance that folks are receiving, through their state unemployment insurance programs. And specifically, the pandemic unemployment assistance program provides benefits to freelancers and gig workers and independent contractors and other people who have been affected by the pandemic. Next. Another major provision where there was a lot of opposition by the Republicans to this bill was assistance and financial aid to states and cities. There have been several studies which show that states are going to incur something like a $50 billion revenue hole this year due to lost tax revenue due to the pandemic, which began in March of last year. And the bill that passed out of Congress will provide $350 billion to states, local government agencies, territories, like the Virgin Islands, American Samoa, individual, tribes around the country. And the bills will give states about $200 billion. The legislation will give about $200 billion to states, while counties, municipalities would split about $130 billion in aid. And as I mentioned, indigenous tribes will get about $20 billion in monies. And those monies will be provided pretty immediately, over the next few weeks to help shore up state and city, treasuries. So the Senate version, which also passed out of the House, also contains a $10 billion coronavirus capital projects fund. This is one of the more controversial provisions, in the American Rescue Plan, but it'll certainly help a lot of states who have laid off or fired various state employees as well as cities who had to lay off, workers during the pandemic. Another major area and provisions embodied in the plan relate to, food and nutrition assistance. The bill that passed out of Congress will extend by 15% increase the food stamp benefits. This is known as the SNAP program, the Supplemental Nutrition Assistance Program, all the way through September. It was scheduled to expire, at the end of June. It will also contain nearly $900 million for the Special Supplemental Nutrition Program for women, infants, and children, which is a special program, as well as other related measures. And it will allow states to continue the pandemic EBT program, which provides families whose children's schools were closed during this period necessary funding to replace free and reduced meals for children that was still taking place under previous economic stimulus packages to shore up that problem. Another major provision was related to housing assistance. The bill that passed out of the Congress for President Biden to sign contains roughly $20 billion to state and local governments to help low-income households cover back rent, rent assistance, utility bills, other related, electric bills for their households. And about $10 billion will be authorized to help struggling homeowners pay their mortgages and utilities, property taxes, other related taxes. The bills would also provide $5 billion to help states and localities assist those at risk of experiencing homelessness, and another $5 billion tab for emergency housing vouchers for homeless people. So that $5 billion is also included in the American Rescue Plan. Another major provision that had bipartisan support, although Republicans did not support or sign on to this legislation, but it was a very popular provision based on surveys and polls by various organizations, are tax credits for families and workers. The bill that passed out of Congress is going to significantly beef up tax credits for families and certain low-income workers this year. And in an effort to combat poverty, this bill would expand the child tax credit over the next year to $3,600 for each child under the age of 6 and $3,000 for each child under the age of 18. So those additional monies will be forthcoming to families who have children both under the age of 6 and over the age of 6. And the credit will be fully refundable, so more low-income parents can take advantage of it, and families could receive payments on a monthly basis rather than a lump sum, once a year. So again, this is going to be a really important provision going forward, and it's expected that it'll get expanded over, not only for this year, but over the next several years because of continued support by all the Democrats, both in the House and the Senate. And it appears there's some support probably forthcoming by some Republicans like Senator Romney, who's been very interested in expanding this program. Another provision is related to optional paid sick and family leave. Neither bill that was in the Senate or the House would reinstate kind of this mandatory paid family and sick leave that was approved in previous stimulus packages. But they will continue as kind of tax credits to employers who voluntarily choose to include these tax credits and offer the benefit all the way through October of this year. And last year, Congress had guaranteed many workers 2 weeks' pay if they contracted COVID-19 or were quarantined, and it also provided an additional 10 weeks of paid family leave to those who were staying home with kids whose schools were closed. But unfortunately, the program kind of expired in late December. Next. And the final bill that passed out of Congress related to education and child care provided nearly $130 billion from kindergarten to K-12 level schools to help students return to the classroom. And so schools are going to be allowed to use these funds to update their ventilation systems, reduce class size for social distancing, buy personal protective equipment, hire support staff due to this infusion of $130 billion. And the bill that passed out of Congress will require that schools use at least 20% of these funds to address learning loss by providing extended days or summer school. So while the money that's being provided by Congress under this provision that's going to go to both public and private schools based on the number of low-income students enrolled, will specifically carve out almost $3 billion for private schools. Next. And the final bill will also include $40 billion for colleges. In addition to the $170 billion authorized for kindergarten to 8th grade for schools, this additional monies will be going to college And also, this bill will provide about $39 billion to childcare providers. So again, we've got this comprehensive package that includes these kind of major funding for schools and childcare providers, as well as additional monies, for colleges. Next. One provision that did not get a lot of play is related to student loan forgiveness. And while the plan does not include specific forgiveness, it does include a provision that any student loan forgiveness passed between December of last year and January of 2026 will be tax-free. So normally the loan forgiveness is counted as taxable income for students, but now going forward, it will be a tax-free provision. Next. So in addition to many of these key relief and stimulus package provisions in the American Rescue Plan, there are several provisions related to healthcare, health insurance, and mental health. And specifically, the bill that passed out of Congress would make federal premium subsidies under the Affordable Care Act much more generous and eliminate the cap that's been in place for 2 years. And enrollees will now pay no more than 8.5% of their income towards coverage. So for every $100 in premium, they won't pay more than 8.5% of the premium out of their pocket, which is down from 10%. So every dollar counts when it comes to individual health insurance premiums through the Affordable Care Act, healthcare.gov at the federal level, or the individual state health insurance exchanges. And also, those earning more than the current cap of 400% of the federal poverty level, which is about about $50,000 for an individual, $100,000 for a family of 4, would become eligible for help. So this bill really does increase subsidies for lower income enrollees, as well as help for middle income families in making health insurance premiums much more affordable through the Affordable Care Act. Next. And both the Senate bill, the House bill were the same, that provides assistance to those who were laid off but want to remain on their employer health insurance plans through COBRA. And the final version that passed out of Congress calls for picking up the full amount of the premium, while the House would only cover 85%, leaving a former employee to pay 15%. So the Senate version passed, which will pick up that full premium. And it will extend these subsidies all the way through September. So again, this major package of economic relief and stimulus has very generous provisions to make it easier, more affordable for individuals to pay for health insurance who have been laid off or fired from their jobs over the last year. Next. It also, the overall plan does again provide more money for small businesses. Whereas the previous economic stimulus packages, many provisions were dedicated to helping larger corporations and small businesses. The American Rescue Plan is more focused on individuals and small businesses. The bill that passed out of Congress will provide long-term low interest rates from the Small Business Administration and other individual small businesses that have been severely impacted by the pandemic, and provide an additional $25 billion under a new grant program specifically for restaurants and taverns and bars. And eligible businesses may receive up to $10 million and can use the money for a variety of expenses, including payroll and rent. The Paycheck Protection Program that's been in place for almost a year now, and is currently taking applications under like a second round of loans that was part of the package that passed back in December. We'll also get another $7 billion and make it more easier for nonprofit organizations to be eligible. So this will be a third round of loans provided to small businesses under economic stimulus. Next. And speaking of healthcare, there are several provisions related to vaccines and testing that are embodied in the law. About $50 billion will pay for additional COVID-19 testing and contract tracing, and another $19 billion will help increase the size of the public health workforce. About $16 billion will fund vaccine distribution and supply chain, something that President Biden has talked extensively about over the last few months. The bill also provides $46 billion to expand federal, state, and local testing for COVID-19 to enhance contract tracing capabilities, and another $14 billion to speed up distribution and administration of the COVID-19 vaccine across the country. Next, there are several provisions in this law related to spending on mental health services. The bill provides an additional $3.5 billion in block grants to states, provided to the Substance Abuse and Mental Health Services Administration, who administers the Community Mental Health Services Block Program and the Substance Use Prevention Treatment Block Grant Program under its jurisdiction. And these block grant programs provide funding to all U.S. states for programs targeted those with serious mental illness and to prevent and treat substance abuse. So these are pretty substantial increases that come on top of a $2.5 billion increase that SAMHSA received in 2020. Next. Specifically, the legislation that I wanted to highlight here provides $20 million for an awareness campaign focused on healthcare professionals for a variety of mental health, behavioral health related programs, $40 million for healthcare workforce, mental health and behavioral health care, $30 million for community-based overdose prevention programs, $50 million for community behavioral health needs. So again, these funding programs are in addition to a total of $6 billion to SAMHSA and $7.5 billion to HRSA that runs several workforce programs. Next. The American Rescue Plan also enhances Medicaid funding for community-based mobile crisis intervention services and really increases dramatically the FMAP, the matching program, to help Medicaid programs and the cost of these programs, which are also supported by SAMHSA grants and are intended to provide, interventions to individuals with mental health and substance abuse needs where the individual is experiencing a, behavioral health crisis outside a hospital or a health facility or outside a community behavioral health agency. Next. And the law also increases dramatically funding in the Veterans Administration, Healthcare Administration program, including $14 billion for healthcare services and related eligible veterans under the VA, all the way through basically the end of 2023. And the VA will have pretty wide discretion on how to use these funds for individual VA facility improvements, suicide prevention and management programs, and other mental health services, including telemental health programs. Next. Finally, one item I wanted to mention that's missing is the minimum wage hike. Based on a lot of parliamentary legislative wrangling, this was not part of the American Rescue Plan. The president intends to introduce the increase in minimum wage in another economic package down the road here, maybe later this spring or during the summer, but it was not included in this package. So those are the major provisions that are embodied in the American Rescue Plan. Again, I would kind of categorize this plan as more of a relief plan, if you will, to get monies to individuals who have been severely affected and impacted, by the COVID-19 pandemic, in terms of stimulus checks, unemployment assistance, help in rent, in food, in housing, all directed towards individual Americans who have lost their jobs or have suffered financially, as well as suffered, due to the healthcare implications of COVID-19. And that I would like to mention that it appears that the president is intending to have another package that he would like to introduce that may be tied in to an infrastructure investment package that he's also discussed that may try to expand some of these programs beyond the dates that I referenced. So with that, I'll be glad to answer any questions. And Rebecca, if there's some that coming in through the chat portal.
Thank you so much, Joel. Everybody, we do have the ability for you to ask any questions to Joel here in the comments section. Definitely put those in there. We do have a couple of questions that were pre-submitted. So I'll go ahead and read those to you while we're waiting for some more to come in the chat. So aside from the specific provisions of the bill and the direct benefits, including the additional funding for mental health services through SAMHSA, what are the implications or indirect benefits for mental health and healthcare of the economic relief provisions in the bill?
No, thanks. No, it's a really, really good question in the sense that it kind of gets at, in a way, this new relief or economic stimulus package kind of gets at some of the social determinants, if you will, of mental health and healthcare, related to, housing insecurity, unemployment assistance due to job insecurity, food insecurity that tries to tackle through the increases in the food stamp or what's called the SNAP, program now, assistance in terms of lost health insurance. And there have been some, recent studies and articles that are appearing that, for example, one study shows that among adults, with, let's say, COVID-19 or pandemic-related financial stress or income, disruption, about 25% of those folks reported, missing, housing or rent payments, or had food insufficiencies. And about 40% of those folks who are reporting those economic problems reported, clinically, meaningful depressive symptoms. And about 50% of those who, based on those surveys and those studies, also reported anxiety symptoms above a clinically meaningful, threshold. So, what we're finding is that the pandemic has increased these problems, and by increasing unemployment insurance benefits, increasing health insurance benefits, increasing the matching funds on the food stamp program, giving people some relief who have missed mortgages or rents, that these things improve overall mental health and overall health care.
Thank you so much. Here's another question. Are we expecting for there to be more congressional economic stimulus and relief packages introduced this year by the Biden administration?
Yeah, as I mentioned, there's been some scuttlebutt that some of the items that they did not include in this in the American Rescue Plan package, like the minimum wage increase from $7.25 per hour to $15 per hour, could be included in maybe other packages that look at infrastructure improvements, in terms of, highways and roads and the electronic grid, those types of issues, that some of these other items like minimum wage could be incorporated into a more overall, kind of package including expanding or extending many of these provisions that were highlighted related to rental, housing assistance, food insecurity, unemployment insurance, and health insurance, depending on how the economic recovery goes over the next several months. Obviously, a lot of that will have to do, with the expansion of the manufacturing and distribution of vaccines. And thanks to, some of the things that we've seen in terms of the Defense Production Act that the president has initiated, we're seeing this expanded increase in vaccine development and getting shots in the arms of more and more Americans. And that certainly may go a long way to helping the economic recovery, which may affect decisions that are made by the administration and Congress on how much more stimulus they would like to introduce or pass to make sure the economy does recover.
Perfect. Thank you so much, Joel. We really appreciate you taking time out of your day to go over these relief packages with us so that we can get a better understanding for what's ahead. If anybody does have any further questions, we do have Joel's information here on the screen. He can be reached at jmiller@amhca.org. We look forward to hearing from you. And again, thank you so much, Joel. We appreciate it.
No, thank you. Take care, everybody.